on the tongue, and this is really good diagnostically, this works really well, is the different parts of the tongue correlate to different organs. At the tip of the tongue, we have the heart, which is the upper part of our body. Right? Then we have the lungs. Then on the sides, we have the liver and gallbladder. And where's the liver and gallbladder? It's on our right side. Chinese medicine energetically says it's on both sides. Okay? Then in the middle, because the earth is the center of the body, the earth element, we have the spleen, aka pancreas, and the stomach. Okay? And then in the back, we have what's on the lower part of the body, and that's the kidney, the bladder, and the intestines. That part, the kidney, bladder, intestines, I don't see clinically that much being relevant, but the rest of it I do. Okay. For instance, if they have a peeled center, only the center of the tongue is peeled, that usually means a stomach yin deficiency. Because the yin of the stomach isn't filling in the tongue. Whereas having a red tip usually means heart heat. Or pale sides, the pale of the tongue is, or the sides of the tongue are pale. That usually means a liver blood deficiency. This part is amazing. It works really well diagnostically.
And does it matter if people have eaten or drank anything within a certain amount of time, or brushed their teeth or tongue in a certain amount of time? Like, how does that affect your ability to diagnose?
So the brushing the tongue affects the ability to diagnose based on the fur. That'll limit it.
Color?
If they don't know, it won't the color, because we just won't see color of fur. But for instance, if they don't brush their tongue, and let's say they just ate something, if they have a greasy tongue coating particularly, it'll pick up the color of whatever they ate. So like eating a curry, for instance, will make the tongue yellow, or drinking tea or coffee or whatever it is. Yeah. So sometimes you have to take that with a grain of salt. Yeah. Eating right before looking at somebody's tongue will make the tongue appear more red because they're moving their tongue more. It increases circulation. There's more blood flow to it. So that'll change it. Drinking water will just make it look a little more moist overall. Yeah. But it won't really make it look greasy, the drinking the water, because that has that mucousy quality to it. Yeah. Good.
What if you, this might be a separate topic, but what if you like eat things that you're allergic to, or like when you say phlegm, I know dairy for a lot of people causes phlegm.
Mm-hmm.
Like, is that at all related to eating that bad day? I mean, is that just a separate piece of the diagnostic, or is that something that also shows up on the tongue?
It shows up on the tongue. People who have food allergies tend to have a geographic tongue, which means it'll be peeled in little spots, and then the rest of the tongue will have fur on it. It's really interesting. I have a picture of one that's not super strong, but it definitely has a geographic quality to it.
So if it's not consistent, then it is a food, potentially a food allergy?
Potentially. It usually means something else, but it could be a food allergy.
Okay.
Yeah. But if they have food allergies and they're eating that food, they tend to develop more dampness, and so you'll see more greasiness as well. Yeah. Because if they have a food allergy and they're eating that food, then they'll tend to develop dampness in their body because they're not able to process it well.